Welcome to the Specsavers Externship Placement Supervisor Orientation for students for University of Auckland. This resource is designed to assist you in preparing for hosting students and guide you through the specific requirements when it comes to externship placements. Firstly, thank you for hosting a student. We recognise this as a significant commitment from you and your team, and we're grateful for your involvement in training the next generation of optometrists, as are the university staff and the students themselves. Their experience while on placement affects students' perception of your store and the Specsavers brand overall, and influences their decision regarding employment. So it is essential that each and every externship placement is a great one. It is equally important that you, your team member, and the patients who attend your practice also have a positive experience. This video will guide you through the specific requirements to ensuring a great experience for all involved. University of Auckland final year optometry students each complete an externship for 3 weeks, 5 days per week. The externship may be split between multiple practices. Students keep and e-log all of the patients they have observed and/or examined, which is submitted to the University of Auckland at the end of their placement, and students are expected to examine 30 patients during this time period. Students will contact you at least 1 week before the placement starts. During the initial contact, the student can be advised of roster days and start times, who to ask for, and any other high-level requirements. Students participating in externship have had the following experiences at the University of Auckland Eye Clinic and other external locations as part of their penultimate year and early final studies. Examined a number of patients in the University of Auckland School of Optometry and Vision Science Optometry Clinic, performed some clinical procedures associated with a comprehensive eye examination, including routine dilated fundus examination on a number of patients under supervision. Performed other clinical procedures including gonioscopy, ocular coherence, topography, and foreign body removal on indication under the direct supervision of an optometrist. Undertaken guided practical experience in the therapeutic management of ocular disease, fitted a number of patients with contact lenses, applied their dispensing skills including recommendation of the most suitable options to meet patients' visual needs, undertaken learning and communication skills including cultural competence. University of Auckland require that students perform approximately 30 supervised full eye examinations or the pro rata equivalent for split week externships. Check the ocular health and any other clinical findings as applicable of each patient that your student examines so that you may provide appropriate feedback to the student. Check that the student's e-log matches the patients they have seen and observed. Complete the student externship evaluation and return it to the practicum placement coordinator within a week of the externship ending. Following externship, students should be able to explain the role of all of the team members in the practice and how they interrelate. Identify how someone new to the practice best fits into the team. Discern the ways in which provision of eye care can be modelled differently from that of the university clinics. Display greater understanding of the role of ancillary tests and procedures and be able to perform them competently in the delivery of high quality eye care. Conduct a thorough eye examination in an efficient and timely manner. Formulate a sound diagnosis and management plan more confidently and independently, and be better practice in communicating this to the optometry supervisor and the patient. Have a thorough knowledge of the appropriate optometric treatment options, including spectacles, contact lenses, vision training, therapeutics, and others. Recognize the importance of accurate and succinct record keeping. Display greater understanding regarding the scope of optometric practice and when to refer for more specialist or medical care. Display increased awareness of the importance of professional behaviour and appearance, and fully grasp the economic realities of optometric practice. It would be beneficial to understand the level of experience and current competencies of the student, as well as their experience with Specsavers. Have they worked in a Specsavers store before? If so, progression through to parallel testing may be more rapid. As a guided structure, it would be beneficial to focus on the retail aspects and patient journey before shifting towards consulting rooms to observe and perform clinical tests.